Hello, this is Dr. Nancy Trimbley with your Healthcare Arsenal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. And my goal for you is that with each passing episode, you get closer to being your own best expert. So today we have Cindy Delich. Did I get it right?
Delich?
Delich.
Yes,
Okay,
yes.
Cindy Delich. She is a compounding pharmacist. Now, truth be told, Cindy and I just met, but honestly, I felt like an instant connection. I was like, you have to be on the podcast. She wanted to defer to another pharmacist in her business, but I was like, no, this is going to be good chemistry. Cindy works for a pharmacy called Custom Dosing, and I have been a client of Custom Dosing for literally decades, probably 25 years. You know my story with my hormone balance, and I am a big proponent of the bio-T pelleting, and from Custom Dosing, I get my progesterone pills. I get my progesterone bioidentical prescription. But there is a vast arena of things that I don't know about. So this is going to be a fascinating conversation with Cindy about compounding pharmacy and specifically what Cindy does every day. So hi, Cindy. Tell
Hello,
us
good
about.
morning.
Good morning. I know it's bright and early for
It's a
us,
little early.
but we had to make it work.
Yes.
So tell us about you.
Okay. My name is Cindy Delich. I've been a pharmacist for over 25 years now, primarily with Walgreens. I joined Custom Dosing Pharmacy in 2017. I do both right now weekly. I do a couple days at both, and I love it. I love integrating both traditional with Walgreens and more. Not so much homeopathic, but non-traditional with supplements and hormones, all that stuff. And I love integrating both and making it knowledgeable and spreading that knowledge to everybody.
Yes, exactly why we have this podcast. Because, like I say, the answer to the person that can help you unravel your mystery could literally be right outside your back door. And with custom dosing, what is their mission at custom dosing? Because and what is compounding
Yes.
pharmacy?
So a lot of people, for one, they don't even know that custom dosing exists. We've been there for 20 plus years, and it's been in Crown Point. And they'll drive by and say this is their first time in. They don't know what compounding is. So compounding is how pharmacy started. You went into a pharmacy and they made what you needed in the pharmacy. Now they have big manufacturers that do that, so those are commercial products. So we don't make commercial products. We make anything but a commercial product. So we make things as for your animals that are come in like a pill form, but the cat can't swallow a pill, so we'll do a transdermal ear medication that gets delivered that way. We will make a pill into a suspension, so and a child can take that medication. We also do different types of thyroid medications. Commercially, it only comes in certain milligrams, let's say 60 milligrams and 90 milligrams, but you need a 75. We will make that 75 because commercially that's not available. So we do all kinds of things, but and then we specialize in hormone replacement therapy.
Cool. Now,
So,
the vision I get in my head when you say this is the way pharmacists used to do it.
yeah.
The movie It's a Wonderful Life, which we have all seen 100 times, there is that scene where the main character, the young boy, goes to his pharmacist where he works and says, "You made a mistake." And he takes out this big canister of powder.
Yeah.
And that's the way it used to be, was
Yes.
all these big canisters of
Yes.
powder.
Mm-hmm.
Right.
That's exactly
Okay.
what it is. So we make suspensions. We make troches. Troches are little lozenges that go that dissolve in your mouth, and you get better absorption. It doesn't have to go through your GI tract. Some people have unhealthy stomachs. So progesterone, like you are on, If somebody cannot, let's say they have gastric bypass and they don't have a stomach or, something like that, we'll develop a troche and it is delivered that way. Yeah, so we just, it's quite fascinating because we will get a call from a doctor from Chicago and say, hey, this is my problem with this patient and this delivery system doesn't work. Can you help me? And we might not know the answer, but we have ways to find out the answer. And a lot of times we can help.
That is very cool because I love, I'm so opposed to the cookie cutter approach to any kind of health care,
Yeah.
any kind of health intervention. So that customization for the individual that's just awesome.
Oh, yeah.
And another point that you bring up, which I think the audience would be interested in, is that our skin absorbs
Oh,
10
yeah.
times better than our stomach as far as anything.
True.
I like to say, be careful what you put on your mouth, but be careful what you put on your
Put on your
skin.
skin.
So I would imagine when you're doing the transdermal, which means through the skin, that application, you have to be super careful with the dosing.
Yeah. Oh,
Right?
yeah. So when I transferred into the role of compounding and changing things over, one thing that I had no idea about is the conversion from oral and transdermal. I would have thought, okay, if I'm taking a pill at 100 milligrams, I probably need like 200 milligrams of that to be transdermal.
To get
Quite
through the
opposite.
skin.
Yeah, quite
Right.
opposite. We need, like on a hormone, it's like maybe like a 3-4 to 1 ratio. So if it is 100 milligrams of progesterone orally, you probably need like a 40 milligrams transdermal. So you need less of it transdermal to be as effective as that orally because you lose so much of that through your metabolism.
Wow. So it's almost like even like better.
Yeah, it could be. Yeah, less systemic effects, side effects. So, if you're waking up and you have that uneasy feeling in your stomach, in your gut, you don't get that with the transdermal. So,
Sure.
Yeah,
That makes sense.
definitely.
Makes sense. And I know there's some challenges with using the skin as the absorption device. Like for instance, I know originally I started out with the transdermal progesterone, and I would have to change spots where I put it every night. It would be like inside of the arms one night, and then on my belly another night, and maybe on my sides another night. The thin skin, I think, is it?
Yeah,
Not
thin
the
skin.
forehead? Is it the forehead too? Is that another spot?
We primarily do the forearms for the progesterone. So, and so if you do, for us, this is how we recommend it, not to say that it's the only way to do it, but progesterone usually goes on the forearm, thin skin. Estrogen, testosterone will go on a fattier area, and it's stored in fat cells. So that's your upper buttock, inner thighs. And one thing that I learned just recently too is when you're doing a transdermal method, you don't want to like rub it all over. You want to pick like a 2x2 section and just rub it in there and let it penetrate through there, not a huge area. So you get better effects that way.
Right. So I guess when you're training a patient to utilize something, there's a little bit more involved than just drop this pill down at night. Right.
Yes. Yeah. So because progesterone does come in capsules or topical, and not one way is superb over the other way. If I have a woman that has a toddler and she wants to get on progesterone, I'm pretty much going to avoid the topical because she is going to be handling her toddler and it's going to be transferred to that toddler. So looking at, things like that. And also the way it is absorbed, progesterone per se, if you have sleep problems, I'm going to definitely go capsule because the cream doesn't have the benefit of a deeper sleep as does the capsule does. So there's pluses and minuses with both.
Absolutely. Yes. And that, that top, that's really a red flag. If there's a toddler in the house or that you handle, even a child that you
Yeah,
handle a lot. Yeah, you don't want those transdermal, because these are hormones and
yeah,
it will produce an effect in the child if
sure.
they get exposed to that.
Yeah, we do testing, saliva tests. So that's our mode of, seeing, determining if they need
If you're
hormones
effective.
or not. Yeah. So if
Hmm.
you have a husband who's on transdermal testosterone, and then we test you for your testosterone, guess what? I bet you that transdermal is on his pillow, which is on your bed, which is, transferred to you. So then you wonder why you're getting a super high testosterone reading. And so transdermals, you do have to be a little bit more cautious for that reason.
Right. Yes, let's talk about the saliva testing. I'm familiar with the saliva testing,
Hmm.
but tell our audience what's entailed with that and why that is your method of choice versus a blood test
Okay.
or just tracking symptoms.
Yeah, yeah. So it's nice because you can come off the street, you can walk into custom dosing without any prescription and purchase a saliva test. We use ZRT laboratories for that test. And in that test, there's a lot of different tests, but our primary one that we use is the full panel is estrogen, estradiol, progesterone, testosterone, DHEAS, and 4 points of cortisol. So that you have your morning cortisol, your lunchtime, your dinner, and then your bedtime cortisol. We chose saliva because with what we have been taught, that especially with creams, if you have a guy with a testosterone cream and you want to test his levels, and if you do serum,
Blood serum.
yeah, blood serum test, you don't get the movement in the testosterone. So then
What do you mean
it,
by
it does
movement?
it won't show the increase. So then you do the serum test and it doesn't show the movement. So then you jump them up. And then same thing happens. You're like, oh, he's really not, it's not effective for him. So you jump him up. And then you have him at a super high dose because the serum test is showing a lower. But if you do a saliva, it's going to show that increase.
So the saliva is more effective in showing a change in the level.
Yeah. And we do a lot of transdermal. So if
Mm.
you are, if you're not on a transdermal, then you can do either. But we do a lot of transdermal. We never do, I shouldn't say we never, we do make estrogen capsules, but usually when we do a recommendation, we are doing estrogen transdermal. So, and that's just
Right.
to avoid a little bit of the cancer scare and all that. So yeah,
Yeah. Okay, so I'm going to circle back to that.
yeah.
But the saliva testing, um, so I didn't realize that that when you're doing a transdermal treatment, that it's better to do the saliva test merely because of that.
Uh-huh.
That
Yes.
I didn't know that.
Mm-hmm.
And the saliva test, which I've done in the past, you spit in a test tube,
Yep.
which sounds pretty easy, but
No,
honestly, it's a bit of it takes
it's
about
so
30
bad.
minutes.
Yeah, yeah.
It's
It's
so
yeah.
bad.
I tell people when they come in, I'm like, if you're that morning tube, that's your biggest one. That's gonna collect everything. The next three is just cortisol, so you don't have to collect so much saliva. But I tell
Oh,
people,
that's
give
good.
yourself at least 30 minutes. And right when
Right.
you wake up, you are so parched, you are so dry, you can't come up with a drop. And yeah, we have a couple of techniques to help get that saliva going. Pressing
Uh-huh.
back here um, will will hopefully get you to produce some saliva. I always cut up a lemon, keep it by my sink, and I just smell it in
Oh,
hopes that it's going to
oh.
produce some saliva. So yeah,
Yes. Okay.
yeah,
And now this is my
uh huh,
curiosity. I don't know. I'm not sure if the audience cares or not, but my curiosity is, okay, so I think of saliva as there's some digestive enzymes and it's to start the digestive process and it's a kind of a lubricant. how do the hormones end up in our saliva?
Oh, yeah, they're everywhere.
They're
They
everywhere,
sure
of
do.
course.
Yes, yeah. I mean, if you think about how you can test marijuana from hair, oh yeah, you can test hormones in saliva. Yeah,
Okay, because they're everywhere, and they're
they are.
so the hormones. We always think, okay, testosterone's for males and estrogen's for females, and you don't need hormones after a certain age, which is a complete misconception.
Mm-hmm.
And that I say what I teach is that, especially when I link it to nutrition and good fats, we need fats in our diet. We need good fats because
Yeah.
fats are what hormones are created from.
Mm-hmm.
Hormones give us our drive, our desire to connect with other humans, it's just like our beauty, like
Oh, it
our
does.
bone density, like all
Two.
this
Yeah.
all this stuff stems from a
Mm-hmm.
hormone
Oh
level.
yeah.
All right, so I'm going to circle back to the other point, but I want to stay on this track. Tell us about that misconception where after a certain age your hormones don't matter.
Oh yeah. So that's a big thing that we get. People do consultations here because they've reached out to their doctor and they say, this is going on, this is going on, and they're like, yeah, that's normal. Suck it up. And
That breaks my heart.
oh yeah, yeah. People will leave a consultation and they're in tears because they have hope. Like
Oh,
they
yes.
finally have somebody that is listening and they might have an answer.
Yes.
So yeah, it's a beautiful thing. That's one of my favorite things to do is a consultation with somebody and just I mean we get pretty deep in our consults. So yeah, just to be able to give them hope when they have been told, no, we don't do hormones. It's normal to feel this way. It's normal to have this huge anxiety. It's normal to not sleep. It's normal to, go through hot flashes. And no, you don't have to do that. So, and the
So,
misconception that women don't need testosterone, that's a misconception. And that a man doesn't need to test his estrogen. He does. Have you ever seen a man with breasts? Yeah, that's some estrogen coming out. So, and with
yeah.
it's great to have that. But then, what do you do when you have a man with high estrogen? There's supplements for that, or a female that has no libido, they're muscle wasting. Give them a very low dose, women's dose of testosterone, and so many benefits. Osteoporosis, testosterone can help rebuild bone. A lot of people don't know that at all.
Mhm.
So
Mhm.
yeah.
Yes. I don't hear about it so much anymore. I wonder if the conventional. Oh, you probably know this about the like the Beniva, the bone
Uh-huh, yeah.
building drug,
Uh-huh.
which the reports I started to hear coming out was that after you're on it for 3 or 4 years, your body's still building bone, but it's very weak bone.
Yeah.
And then side effects are gastrointestinal upset, like that will make people just go off of the drug because it's so horrible.
Right.
And to know that just getting your hormone levels checked, everybody should have balanced hormones no matter what.
Yeah.
And when they're out of balance, I say the hormones cause the minerals to stick to the bones.
Mm-hmm.
Is that pretty accurate? Is that an
That I
accurate
don't.
dumbing
I
down of it?
don't know. I don't know, but yeah, something I'll check into for sure.
This is what I see when I do x-rays on people is, there'll be a certain age, a female or male, and, they'll say, yeah, I had a bone density test, I have osteopenia or osteoporosis, and I look at their x-rays, their blood vessels have calcium deposits.
Oh yeah.
So the
Uh-huh.
minerals are there.
Yeah. Right.
They're just not going to the bone. And
Uh-huh.
that's kind of my take on it. It's like, okay, let's get your hormones checked. Let's
Mm-hmm.
just see.
Yes.
So now your favorite client, by just you talking, sounds like a female that has all these, like all of a sudden a light switch goes off and they
Right.
can't sleep, they're irritable, they
Mm-hmm.
have no libido, they like their whole like what they knew themselves to be
It's
is
gone.
different.
Yeah. Uh-huh. Oh yeah.
What what other like tell me a story about somebody that is going through that and how they came in and how they progressed.
So we have, I mean, there's so many different ones. I don't know, like weight issue, huge. I mean, marriages are on the brink sometimes when they come here, whether it's libido or it's just irritability, that feeling of overwhelming. You know, when you walk inside the house and there's something misplaced, but you feel like your whole house is messy just because that one little thing. It's that overwhelmed feeling. And this is usually from a drop in progesterone. This is like your PMS symptoms. Some people have such low progesterone all the time. So I know, luckily, when I got my PMS symptoms were just one day. You know, a couple days right before I started my cycle, I would have this feeling of kind of like rage. Well, imagine if you're married to a woman that has that all the time and she can't control it. She knows how she's reacting is bad, but she can't even control it. Then we put her on, you know, we give her a recommendation. She comes back or the husband comes back to the pharmacy, gives us a bottle and says, hi, my wife needs a refill on this. And I'll look and I'm like, oh, I'm sorry, but it has no refills on it. And then his face, oh no, I have to deal with her not on this. So, I mean, it's pretty amazing to see the reaction from both after they are on it and the changes and to hear the stories. And I'm not saying that it's 100% effective for everybody. I'm not saying that every depressed or high anxiety person needs hormones.
Right.
But I'm saying that it is something to think about and talk to your doctor about and see if that's an option for you.
Right. And I know, I mean, I feel so bad for men when women are having a PMS day. I mean, having obviously lived through that and knowing I can't even have a conversation this week.
Yeah,
I need to just
right.
do my daily stuff and then try just don't say anything because
Yeah,
everything comes out wrong.
yeah.
You don't feel well. You don't feel
No.
like you look well. Like your
Mm-mm.
makeup doesn't stick on your face. Your clothes fit wrong. Like,
Right.
you know, it's just like, and you just know you have to wait it out. But imagine when your body is changing and going through menopause, it never stops. It
Right. It
only
never
gets
stops.
worse,
Yes.
and you can't help it.
Yeah.
I know, I know. My husband would say to me like, "I- "Are you okay? Like,
Yeah.
is something wrong? Like, tell me what's wrong." Be like, "Nothing's wrong."
Uh-huh. Right. You're like, I don't know. If I knew, I would fix it, but I can't fix it. And you know what's coming out of your mouth is not correct, you know, but yeah, you can't control it.
Yeah.
So,
So, yeah, it can be, like you say, life changing,
mhm.
marriage saving.
Yeah.
I tell women that are kind of going through that, saying, you will get your sanity back. Let's
Yeah.
check into this.
Hmm. A lot of it's sleep, like a huge, I focus on sleep so much. And, you know, if you have any thoughts of maybe having sleep apnea, go get that sleep apnea test. Sleep is where you repair your body. Sleep, if you get certain levels of sleep, that's where your hormones are produced. So if you're not sleeping at that level, you're not producing hormones. Therefore, everything just decreases.
Oh my
So,
gosh, so that's fascinating. Okay,
yeah.
so yeah, and of course that makes total sense. There's a great book called Why We Sleep. It's by a sleep researcher. I found it fascinating. It has all his research in, and he says we do so much work on our body while we're asleep mentally
Oh,
and
yeah.
emotionally and
Uh-huh.
physically that it's a wonder we're awake at all.
Right.
Um, so yeah, to think about that connection with you're not sleeping because your hormones are out of whack, and then your body can't repair and create more
More
hormones
hormones. Yeah.
because you're not sleeping, and then it becomes this horrible vicious
Slippery
cycle.
slope. Yeah.
So sad. Oh, so true. And the sleep apnea, that a lot of people suffer with that too.
Mm-hmm.
That's
Oh, yeah.
that makes it's all connected.
It is.
And so let's talk about the aspect, like you mentioned before, the cancer scare
Mm-hmm.
related to estrogen. Let's dive into that a bit.
So, you know, as with any type of supplements, they don't do too much testing on anything that's not a commercial product. And your
Yes,
your hormones
good
are,
point.
yes, there is not
Hmm.
FDA regulated. But, you know, how many patients we have served, and you would think that if we're pumping out patients with this topical estrogen, that we would see a huge increase
Uptick.
in cancers, correct? And
Right. Crown Point would see a huge uptick
yeah,
in cancers, and it
yeah,
all relate back to
yeah,
to compounding pharmacy, and it's not.
yes, yeah, we have not had that impact shown to us. We do topical, and that is a reason, because if you're ingesting oral estrogen, we do think that the increase will be there. That's why our method is transdermal estrogen. Progesterone, we don't really have to worry about that. We use a natural progesterone. It's not a progestin. Progestin and progesterone are different. Progestins may have that increase in risk of cancers. So we do the natural yam-based progesterone.
So for the estrogen, because you're doing the transdermal with that,
Mm-hmm.
right?
Mm-hmm.
And because you're going back and you're retesting, the way I like to explain it to some women that are freaked out is that you are in danger if your hormones are out of whack, if they're not
Mm-hmm.
balanced. That's when you're in danger.
Yeah.
And when you go on a bioidentical hormone to balance things, that protects you.
Yeah.
And also you are retesting probably later on
Yeah.
with okay. And then
Yes.
that tells you that we're hitting our target. We're not over prescribing.
Yeah. Yeah, one thing we do, and I always tell my consults, is I will not pump you with a high dose of any type of hormone to get an immediate effect. I am a go low, go slow. You may get a little bit irritated with how low I am, but I'm not a believer of high doses right away. Let's get you, fixed right away so you're feeling better, because I'm not going to put you at risk like that. Exactly. So you will have to take a little bit of time, adjust your dose. And that's another reason why creams are a huge benefit too. So we might put you on a lower dose of estrogen cream, but it's so easy to increase your dose by how much you put on. So if I put you on a lower dose of cream, I can just tell you to because it comes in a toppy click. So each click gives you a different amount that you're applying. And with each amount that you're applying, it goes up. So does the milligrams that you are using. So it's wonderful to be able to start somebody on a low dose and say, hey, do 2 clicks, which is a half of an ml, and do that for like 6 weeks. And if your hot flashes are still there, you know what? Go ahead and add a click. And then let me know if that's effective or not. So it's very nice to give them a little bit of control too with the cream.
Mm-hmm. And it does take a while. It does take probably a full month to really notice all the effects, because these are micro amounts, and hormones are normally micro amounts in our body, and it does take a little while. So yeah, we can't expect an overnight change. Although sometimes I'm sure that happens.
Yeah. Oh yeah. Yeah. Once in a while, I'll get that call like 3 days later, like, this is amazing. I'm like, wait, you started so low. How are you to an effective dose? But, and a lot of times it is just 3 nights of good sleep. 3 nights of good sleep. Wow. The brain fog is gone, and everything just starts working a little bit better. So.
Right. So what would be the first step for somebody that is thinking, this is my route, I need to check this out?
Yep.
What would they do?
So we get that call all the time, like, hey, hormones, like, how do I do this? So first thing is, you have to have a doctor willing to prescribe. You can go through every step that I tell you, but at the end, when I think that a hormone is needed, I need a prescription signed off. So what happens is, you talk it over with your doctor. They say, yeah, I'm on board. Let custom dosing do their thing. You walk in, you get a saliva test from ZRT. You purchase that. So the full panel is $240. You pay that, you take it home. If you're cycling, you have to collect that saliva on days 19, 20, or 21 of your cycle. Day 1 is the day that you start cycling, that you start your period. If you're not cycling, you can do it anytime. You collect all that saliva all in one day, and then it gets sent off UPS. And within about a week or two, we get the results. We'll call you. You can set up a consultation. There are some providers that they don't even need us, that they will take that ZRT saliva test results and then they will create their prescriptions. Most people use us in our consult. That consult, if you need it, is $80 if you do a full panel. We do have some doctors that will do serum tests in their office. They fax us their results, and then we just do a consultation. That is $120 if it's not a ZRT consultation with those results. And then from there, I'll have a consultation with you, and it's usually, and we also do this. So I'm from the Crown Point location. We have 2 locations, Valparaiso and Crown Point. So we have Liz in Valparaiso that does what I do in Crown Point with the consultations. So you'll make a consultation with us. We'll sit with you. You bring everything. You bring any type of lab results you want to bring. You bring all your supplements, all of the medications that you're on. We'll discuss everything. And then we'll go over your symptoms. And then we'll create a plan of action. And if it requires a prescription, I or Liz will write out the prescription entirely. We will fax it to your doctor. All they have to do is sign off on it. So
Excellent. And then you can start the process.
yes.
So it's, I mean, that sounds really easy. It sounds like you're covering a lot of bases.
Oh yeah.
The one stumbling block I know some people can face is they ask their doctor and their medical doctor says, "Oh, you don't need that." Or, all right, and then what? Then what would that person do?
They have to decide, is what they are battling so significant that they want to try it. Then they would need to find a physician that, a different physician that will allow them. So
do you keep a list?
We have a list in the pharmacy of doctors, nurse practitioners that use us. And so we don't have like 1 or 2. There's like a whole, I don't know, probably like 25, 30 on each from Porter County and Lake County. So, yeah.
Yeah, I think that's what, when people come to me sometimes for, various things, my doctor doesn't want to follow this path. Can you recommend anybody? And I have, we have our list of, kind of like non-conventional friendly practitioners that are, just willing to help their patient along on their path.
Yeah.
So that's awesome.
Yes.
So I have one more question for you, and I didn't preview this question.
Okay.
So here we go.
Okay.
If you had a billboard for all to see, what would it say?
Oh gosh. Be your own advocate. Yeah,
So
you have to do you. So even this holds true to, if I say that estrogen is going to benefit you, but you have that feeling like, oh, estrogen is cancer. No, don't do it. You need to sleep at night and you need to do you. So if I tell you something and that's going to be fearful for you, don't do it. If the doctor tells you something, but you want to try something because your life is that miserable, then you do it. So it goes both ways. So you have to be able to sleep at night with your decision.
Awesome. I love that, Cindy. And that was a new one for me. I've never had anybody answer that. And that is so part of my my mission and philosophy, is that you're your own best expert. And you need to follow your path, and you need to do your own research.
Yeah.
Absolutely. I love it. Well, this has been great. I am so glad that you're able to meet with me. I think my audience is really going to get a lot out of this. So for our audience, thank you for being with us today with your Healthcare Arsenal podcast. And as always, with each passing episode, my hope for you is that you get closer to being your own best expert. Bye for now.
Bye-bye.